afternoon, Facebook. I'm Erie Times-News online reporter Sarah Grabsky. Joining us today is Erie Times-News reporter David Bruce. We are in the newsroom. As you can see behind us, we are going to be talking about a really hot topic that we have been talking about quite frequently over the past week, which is the UPMC Highmark consent decree. I'm sure that you've read the stories. David has been covering this for what, a decade now?
Seems like a decade. It's been about eight years, almost 8 years off and on.
All right. So today we're going to be talking about obviously news that unfolded last week. David, fill us in on what that was.
Sure. As folks, let's give a real quick background on the consent decrees between Highmark and UPMC. These are agreements between Highmark and UPMC, also involving the Pennsylvania Department of Insurance and the Attorney General's office, where the two agreed. There's a series of them, but there are ones that they are under right now, where they are basically agreeing to see each other's patients at their hospitals through June 30th of 2019. After that, most folks with Highmark health plans will not have access to most UPMC hospitals, and folks with UPMC health plan insurance will not have access to Highmark's hospitals with the Allegheny Health Network, which includes St. Vincent Hospital. That's the background. What happened last week, as we get toward the last few months of the consent decrees being in effect, the State Attorney General, Josh Shapiro, held a news conference down in Pittsburgh, which I drove down to, and he announced that his office was filing petitions. They were going to court to modify the consent decrees and to extend them in an attempt. Now, they can't do this unilaterally. What had happened was there were negotiations going on between the Attorney General, Pennsylvania Department of Insurance, Highmark, and UPMC to try to get them to extend and modify the consent decree so that there wouldn't have this. Folks with Highmark insurance would no longer have access to UPMC. Folks with UPMC insurance would no longer have access to Highmark. What happened as a part of those negotiations, we found out at the press conference on Thursday, is that Highmark agreed to those modifications. UPMC did not. As a result, the Attorney General has filed a petition with Commonwealth Court in Pennsylvania to force these modifications to the consent decree. And these changes would, in fact, make it so that each health system, UPMC health system, Allegheny Health Network, any other health system in the state, would have to negotiate with health plans who want to seek contracts with them. If the negotiations fail, then they would go to what is called best last offer arbitration, which Attorney General Shapiro called baseball arbitration. And as a baseball fan, I know what he's talking about. Where they each submit one plan, and then a panel of experts would then pick which offer is the best. So basically, any health plan would be able to sign with any health system and have their patients have in-network access to those hospitals. There are some other things, we'll get into those a little bit later, that the Attorney General wants to modify to the consent decrees. But to wrap this part of it up is that they have filed the petitions. The Attorney General's office has filed the petitions in Commonwealth Court, and it looks like we're going to have a court battle.
So and you and I were talking about this earlier, what are some of the possible outcomes of this legal action?
Sure. We're still learning about this. But during the press conference on Thursday, the Attorney General indicated that he hoped that perhaps by filing these petitions that this would bring UPMC back to the bargaining table. I mean, he said many times Highmark has agreed to these changes. He hopes that UPMC would. Talking with folks from UPMC, they had put out a statement the day of the Attorney General's press conference, talking with Paul Wood, their top spokesperson for the health system. He had said, nope, we're ready to litigate. So it appears UPMC is not going to go back to the bargaining table, that they are going to have a court battle. So that's one. A judge could rule that these modifications can be made. And then what would happen is the consent decrees would change. They would not end on June 30th, depending on what other changes are made, and that these rules that I talked about earlier would be implemented, that health plans who want to have a contract with a health system would negotiate, the health systems would have to negotiate, and if they can't reach a deal, there would be arbitration. Another thing that could happen is the judge could say no, and then the consent decree would expire as it is indicated right now for June 30th.
And we have a question. I think this is a question that we all kind of have. And David, you probably won't be able to answer this, but what is the likelihood, or do you personally think that that will happen, that a deal will be reached to extend the consent decree?
I have no idea. The Attorney General is confident. He is confident that something will be decided, and decided quickly, before the end of the consent decree, which is June 30th. I have no idea. My job's to report. I wouldn't even hazard a guess whether this is going to be approved by a Commonwealth court. I would imagine, as with many court cases, if it goes against either the Attorney General or goes against UPMC, they could appeal it to a higher court. Could be eventually settled by the Supreme Court of Pennsylvania. But no, my short answer is no, I don't have a guess on this.
Have we ever seen anything like this before, where the AG has gotten involved in something like this, or? Not in
healthcare that I know of. No, I don't know. I know this Attorney General has had been very outspoken and has done things with, as far as the sex abuse scandals with the Catholic diocese in Pennsylvania, multiple. But as far as this, no. But nothing regarding UPMC and Highmark surprises me at this point after all these years.
Right.
But no, this does not make me remember anything similar to this at all.
So speaking, kind of going down that historical lane a little bit, how many times has this happened where there's been an extension, and then the consent decree has been reached, and more extensions? How many?
Yeah. Well, it all started back to 2011. What had happened is that, and regarding who you talked to, who started it, but in a nutshell, UPMC wanted higher reimbursements for the medical services they provided from Highmark. Their physicians, they wanted higher reimbursements for their physicians, the procedures, the surgeries they do at their hospitals and at the medical offices. Highmark balked at that, and as a result, or soon after that, announced that they were going to buy the West Penn Allegheny health system down in Pittsburgh, which is was a financially troubled health system down in Pittsburgh, and it was also the biggest health system outside of UPMC down in Pittsburgh, their main competitor. UPMC did not oppose Highmark buying that health system, but said at the time, well, this makes us true competitors. We both have health insurance plans. We both now have health systems. We are competitors. So we should, UPMC speaking here, we should break off ties, each have our own silo, and we'll take care of UPMC health plan folks, go to UPMC hospitals or non-Highmark hospitals. Highmark folks should go to non-UPMC hospitals, and we will really compete as two integrated health systems. I might not be right on the term on that. That was a term I remember but basically health systems and insurance is all combined together.
Right.
Highmark wasn't so thrilled with that. They wanted to have the hospitals, but they also wanted to accept UPMC health plan at their hospitals and their doctor offices. And that's kind of a fundamental difference that I have found talking with officials from Highmark and from UPMC, is that Highmark still wants access to patients with UPMC health plan. UPMC does not want Highmark have access to UPMC hospitals.
Talk a little bit about that. I think a lot of people are wondering what's behind the thinking of UPMC right now, because from a consumer standpoint, you look at it and you just think they're being, a lot of people on here have already said greedy, use those type of terms. Right. You've talked to some of the officials.
We've talked for eight years about this. As I said a little bit, it's a slightly different business philosophy. UPMC sees themselves, and what they've said to me over the years, as now direct competitors with Highmark. They are in the exact same business. They both have hospitals, physician offices, and insurance plans. They are absolute direct competitors now in Pittsburgh and up here in Erie, with Highmark, with St. Vincent being part of Highmark's Allegheny Health Network, and Hammett being part of UPMC. So they want direct competitiveness. They don't want their insurance to go to Highmark. They don't want to support Highmark through their insurance plan. Highmark has a slightly different philosophy on it. It's different business philosophies.
Right.
But the problem with that is, as we've seen, many people have Highmark insurance. And it's not just Highmark insurance. It's most Blue Cross Blue Shield plans, other than the Blue Cross Blue Shield plan in Buffalo, which has an agreement with UPMC. Most Blue Cross Blue Shield plans will not have access to most UPMC hospitals.
Right.
And when I say most UPMC hospitals, most of these are affected by the consent decrees ending, except for a handful. Children's Hospital, because it is a pediatric hospital in Western Pennsylvania, they have a contract with Highmark through 2022. Western Psych has a contract, I can't remember what year it is. And then many of the rural hospitals have contracts, such as UPMC Northwest, UPMC Horizon, and some of the other ones in Western Pennsylvania that are smaller rural hospitals that really, they're the only hospital in their county.
Mm-hmm. We had one commenter, and you and I talked about this briefly again this morning, saying they should not be tax exempt. Is that something that Shapiro has kind of raised, or? He
did not mention that. He spoke, he and some folks that he brought who have been affected by this, patients who don't have access. He had a whole boatload of them, plus Lieutenant Governor Fetterman was also there. But Shapiro, Attorney General Shapiro, did not mention going after UPMC's tax exempt status, but boy, he spent a lot of time talking about UPMC's finances.
I bet.
Part of that is because part of the charges he has against UPMC is that they are violating the state's charity laws. UPMC counters, they provide more than $1 billion a year in community benefits. Mm-hmm. Attorney General Shapiro says yes, but they also receive an incredibly high amount of money in tax benefits, not paying property taxes or paying a portion of the property taxes. Like Hammett pays 50% of their assessed value at their properties in payments in lieu of taxes. So that yes, they do a lot of good, but they also get tremendous tax benefits for being nonprofit, and he holds them to a higher regard. But specifically going after that tax exempt status and requiring them to pay full property tax values, he did not mention that at all, which was a little bit of a surprise to me that he wouldn't even mention that. Instead, he is going after the consent decrees and trying to modify them directly through the court system.
Another question that we had, or comment that we had, that I actually had mentioned to you again earlier. Somebody says that she has UPMC primary. Can she still go to an AHN provider, which is Allegheny Health Network? We have really talked a lot about how if you have Highmark, you're not going to be able to go to UPMC, but we also haven't really touched on if you have UPMC's health plan,
right,
you're not going to be able to go to Allegheny Health Network anymore.
And that seemed to be up in the air for a while. I had been talking in previous months earlier last year with folks from Highmark and from St. Vincent, and the thought was, yeah, they still wanted to accept UPMC health plan. Late last year, that changed, and what I was told was, no, if you had UPMC health plans, you were not going to be, after the consent decree ends, have access to Vincent in network or any of the other hospitals. And when I say in network, what that means is that at the low rate, you might have out of network access, but in many cases that includes paying a lot more out of pocket.
Right.
And in fact, part of what the Attorney General spoke about, Highmark a couple months ago, toward the end of last year, spoke about offering its subscribers who have Highmark insurance that they were going to help pay the difference for folks who go to UPMC hospitals. They're going to pay the difference between the in-network and out-of-network costs. UPMC countered and said, well, their policy for folks with out-of-network plans that come to UPMC hospitals and doctors' offices is that they would require them to pay the entire cost of the visit or the procedure out of pocket ahead of time, and then they would get a receipt and go to their insurer and then get payment back from them. That might be fine for a primary care office visit. That might cost you in cash $175 or something like that. But a procedure that could cost tens of thousands of dollars, it's just not feasible for most people.
Right. A lot of people, and kind of branching off of that, a lot of people have wondered, well, how does this affect me? You know, this is a huge deal in the UPMC Highmark world, and almost all of us are affected by it. So as a consumer, how should you handle this?
Well, and folks who read our special section late last year about the consent decree, it was basically, it's coming. June 30th is the last day that most folks with most Highmark insurances, other than maybe some Medigap plans that are available to seniors, June 30th will be the last day for the rest of us to have access to most UPMC hospitals. And vice versa with folks with UPMC health plan insurance have access to St. Vincent and the other Allegheny Health Network hospitals. Now we have to stay tuned. We have to see what this court battle is going to be. The Attorney General said he is absolutely trying to get this a solution to this before June 30th. He doesn't want the consent decree to end and then have to restart again. But again, that's assuming that his modifications are approved. There is no way of knowing that at this point. So right now, folks should still take preparations that if they have Highmark insurance, they are not going to have access to most UPMC hospitals after June 30th. Folks with UPMC health plan insurance, they are not going to have access to St. Vincent and other AHN hospitals and doctors' offices.
We have a few specific questions, and David, maybe you can help, and he might have to refer to you to...
if I don't know, I'm just going to say I don't know.
What happens if you have UPMC for you and you have St. Vincent's doctors? So
you need to call your doctor's office. I believe Medicaid plan, I'm going to say I don't know. You need to call your office. I remember somewhere that Medicaid plans are not part of this, that it is commercial plans and it's Medicare Advantage plans for seniors, but you need to call your doctor's office. They will know for sure. I would call as soon as possible. They will know whether you have access or not after June 30th.
We had another woman saying her daughter goes to, and I just lost the comment. Sorry, bear with me, guys. Okay, my daughter goes to Hammett for speech. She has Highmark as her primary and UPMC for you as secondary. I'm being told by her speech therapist that she will be considered out of network come June. Why can't she use her secondary? Any info on that would be appreciated.
No, and I'm hearing that. I was talking with someone else who has Medicare as their secondary, basic Medicare, and they also are being told that. So it must be something that about your primary, but I'd be guessing. And again, I don't have a specific answer for that one. See, there are, and this illustrates how many tentacles this issue has.
Right.
I mean, I don't know of another reporter up here in northwestern Pennsylvania has spent more time on this subject than I have.
Yes.
And I don't know nearly all the answers and all the ramifications to this. This has tentacles in people's health care in ways that I haven't even heard of. And I've been covering this for 7.5 years. This is something new. If you have something as a primary and you have Highmark as a primary and UPMC as a secondary, it seems like it would make sense you could just go to your secondary. Doesn't seem to be the case, but again, contact your insurance company, contact your healthcare provider, the speech therapist in this regard. They do, both Highmark and UPMC have folks, phone numbers, I don't have them offhand, that are trained in dealing with this. I would reach out to them and get answers, and you want to do it sooner rather than later.
So, what else, David? Anything else you want to add? I'm like,
it was interesting. The Thursday press conference was interesting. This is an attorney general who does not shy away from a fight. It was very interesting to learn that Highmark agreed to this. UPMC did not. We are going to keep tabs on this. One, we'll see if even though UPMC was very direct in how it said it was going to react to the petition being filed, that they are ready to litigate. We'll see if they go back to the table. Otherwise, we will track this court case as it winds its way through, which sounds like it's going to happen pretty quickly. And in any story we do, we'll explain not only what happens, but what it means to the countless number of folks in northwestern Pennsylvania who have insurance either through Highmark or through UPMC Health Plan.
Yes. Thank you guys so much for joining us. You can continue to comment on this feed, and hopefully David and I can get some of your questions answered if you're missing us live. If not, dbruce@timesnews.com. He's here to help, always. All right, thanks guys. Have a good afternoon.